Welcome. This is Jean Eaton of Information Managers. It is my honor and pleasure to be with you today at Practice Management Nuggets. This is a weekly interview series with practice managers, healthcare providers, or trusted vendors who support healthcare practices. Our topics help primary care practice managers, healthcare providers, and owners to implement, maintain, or improve their business and practice administration so that healthcare providers can focus on providing quality healthcare services. I am your host, Jean Eaton, the Practice Management Mentor with Information Managers. And this week I'm delighted to introduce our guest, Susan Keane Baker. Susan is an experienced healthcare professional with 17 years and more experience as a vice president at the New York and Connecticut hospitals. Susan is the author of Managing Patient Expectations, The Art of Finding and Keeping Loyal Patients. She is known for practical, relevant content in a dynamic and an enthusiastic manner. Susan inspires staff or association members to implement strategies that result in enhanced job and patient satisfaction. I am delighted to have you with us today, Susan, for Practice Management Nuggets, and I'm excited to learning about implementing patient satisfaction programs.
Thank you, Jean. It's my pleasure to be with you.
We are going to pack full of 30 minutes of information, and we're going to get started. Susan, we've had a couple of opportunities to chat and to learn a little bit more about you. You have come from an organizational corporate healthcare environment. How did you get to where you are today?
Thanks for the question, Jean. Well, as a hospital chief operating officer, it was always troublesome for me when a patient would file a malpractice suit against a physician. And it was especially troublesome when the malpractice suit had no merit clinically, but was the result of mismatched expectations or unmet expectations. And so I really set out to try to improve the kinds of communications that would prevent patient injury and minimize the risk of practitioners being sued. And so I wrote the book Managing Patient Expectations around that concept.
Okay. So even though you've come from that corporate healthcare view, the managing patient expectations is something that we need to do in all levels of our healthcare systems.
Absolutely. So important.
Absolutely. Susan, if there's only one thing that healthcare providers and clinic owners can do today to implement a patient satisfaction program, what would that be? What would be your number one tip?
The number one tip would be that if a practice manager has not already done so, to pull out the patient satisfaction survey that's being used by the practice or the system, and if none is being used presently, to find an evidence-based survey online, the CG CAHPS survey, CG-CAHPS survey used in the United States would be a good model. Pull out that survey, make copies for everyone in the practice, and spend a few minutes asking people to complete the survey the way they believe the average patient of the practice would complete it. And where they don't give the practice the highest ratings, what would need to be done to raise the bar in that area? It's very surprising to me how often senior leaders are concerned about the patient satisfaction scores, but people providing the care have no idea what the questions are. And so, in essence, they are being tested on material that the teacher has never covered in class. So learning what those evidence-based satisfaction survey questions are is very, very important. If people haven't seen them in the last 6 months and you were to ask people if name 5 questions on the patient satisfaction survey that we use, I would bet that the vast majority of people in the practice couldn't tell you what those questions are.
That's a really good point. Having an evidence-based patient survey is something that is going to provide some continuity, some consistency, and if you can borrow somebody else's expertise, you don't have to reinvent the wheel yourself.
So true.
Now, the CAHPS survey that you're referring to is specific to the American healthcare system. So it doesn't apply in the Canadian practices, but it's still a great opportunity to be able to have access to those survey questions. And again, we don't have to reinvent the wheel. We can make use of them in our Canadian environment.
They're in the public. The questions are in the public domain, so yeah, you could take them and customize them. What's interesting about the CAP survey questions is that rather than patients rating, for instance, did the staff treat you with courtesy and respect, rather than rating that on a poor to excellent scale, the scale goes from never to always. And always is a very high bar to reach, but that's something that exceptional practices will be striving to do, and that means the same respect and care is given to we'll put them in quotation marks, the patients who present with challenges as we do for our favorite patients.
Sure. And those questions on the survey are things that we can certainly still strive for in the Canadian healthcare system. The accreditation program and the accreditation bodies in Canada are moving to having a similar type of a system, that there is some compensation or some recognition for those providers that are providing excellent care. So we don't have a full scope of surveys and questions in Canada that are being done or administered or are providing some compensation at a provincial or federal level, but we can still make good strides in improving our practices and using that information.
In the British system, the key question is the patient's willingness to recommend the clinician or the practice to friends and family. And if you're going to go with one question, that might be the question, and then what is the reason for your rating, or what could we do to achieve a higher rating? And I have recommended to some of my clients who are just starting a patient satisfaction initiative to just ask that question of internal staff. Give them the opportunity to score, do they recommend the practice to family or friends, and then for a number 0 to 10, and then with 10 being absolutely all the time kind of thing. And then what could we do to earn a higher score from you? What's the one thing? Asking that open-ended question. And then, of course, it's interesting to know that there's been some research done that has indicated that there's a correlation between people's willingness to recommend a practice and the quality of the practice's website. So a recommendation that I often make is that the team together spend some time developing a frequently asked question database. And all this takes seriously is to write down for a week the questions that patients ask, tabulate them, and then start with the most frequent ones, which often are things like, where do I park? What time are you open? Do you take my insurance plan? And as a team, craft the best answers to those questions and then put them on the website. Because if you answer a question for one person, you've helped that one person. But if you answer a question on your website, you help a number of people, and you reduce the number of phone calls to your practice for routine information. My favorite example that I would love to share around this is Blue Hill Memorial Hospital in Blue Hill, Maine. And if you go to the billing section of their website and look at the FAQs, they have what I believe to be the best description of things like co-payments and deductibles. And if you think of how much time we spend answering questions about insurance for patients, if it's all neatly tied up in a bow and you can say, do you have access to the Internet? Let me show you where it is on the website so that if someone asks you, you can refer back to this.
That's a great tool. I didn't realize it was so tightly connected to patient satisfaction scores about having a good website.
On the willing to recommend question, it is, and I believe that's probably for two reasons. One, people like it when they can have information 24 hours a day. So answering for questions for people while you're sleeping is I think, worth the time it takes to develop those questions and the best responses to them. But the other reason is that when people do recommend you or are thinking about recommending you, they're also going to say to the person, well, let's take a look at the website to see if we can get an answer to that question. And it makes the practice look credible when the information on the website is up to date and is user-friendly.
Excellent. And being able to have the information on the website reduces the amount of time and effort for your staff when they could be doing other things that are more unique and patient-centered for the individual that's standing in front of them.
Yes, we answer the same questions over and over and over again, and most of us develop internal scripts. When the questions come up, we answer the question in a way that we know has worked well for people in the past. The only problem with internal scripts is they can be inconsistent across the practice. So if you have one person answers the question and then the patient asks someone else and that person gives a slightly different answer, now the patient's confidence is shaken and they're either going to ask more people the same question, where it's the information on the website. It also serves as a nice hiring tool, I think. You can ask people those questions, how do you handle this, and see if what they answer is a good match for how you do things in your practice.
Absolutely, and being able to repurpose that content in so many different ways.
Absolutely.
So one of the things that is connected to this is how patients decide to trust the service. You have to be able to trust the healthcare provider and the practice before you're prepared to refer them. So what do we do to help patients decide to trust us?
Well, there are three questions that patients are asking about the practice and the people who provide care and service in the practice. The first is, can I trust you? And the second is, are you good at what you do? And the third is, will you care about me? So when we look at can I trust you, obviously things like patient confidentiality and safeguarding patients' health come quickly to mind. The amount of time spent with the patient, there's a correlation there to patients feeling that they can trust the person because the person cares enough or is interested enough to give time. And then the question, are you good at what you do? And things like being prepared when a patient arrives, knowing who that patient is and being prepared, having reviewed the chart ahead of the visit and not for the first time in the examining room. Things like just using your last name when you introduce yourself increases the patient's perception of your competence. And the third question, will you care about me, sometimes gets to some of those unexpected things, like maybe appropriate touch from someone as a patient is exiting, after visit summaries. And there's a lot of data on the internet around after visit summaries, but a checklist that the patient takes with him or her that talks about, what was the reason for the visit today and what instructions am I supposed to follow through on, what changes in my medication, what should I be doing before I leave the practice, when is my next appointment recommended. An after-visit summary form can be for patients one of the most important things that they take away from the practice that makes them feel truly cared for.
Excellent. Okay, so to have patients recommend you, you want to be able to build that culture of trust so that the patients feel comfortable in recommending you.
And, who knows an organization best? It's people internal to the organization. When I was being married, my mom said, Susan, don't tell your friends bad things about your husband because you'll forget what they said. They'll always remember. So what people internal to the practice say about it is just hugely related to the kinds of attitudes and behaviors and how much trust people have when they come for care. And so the simple action or the simple behavior of saying something positive about the next person who's going to be providing care for the patient can really help answer that second, are you good at what you do question. And for instance, if a transporter is escorting a patient to the radiology section of the practice, the transporter may feel like this is the 40th patient I've taken to radiology today. Do I really have to say something nice about the radiology team each time I go? Well, if you're the one patient and you're anxious about the procedure and somebody internal to the organization takes a moment to say, you are just going to love Jean Eaton. She is so conscientious about patient care and safety or, whatever is special about Jean, that patient just now relaxes a little bit. There's a decrease in the anxiety, and the person is probably an easier patient for Jean then to care for.
So having positive self-talk amongst the team and positioning the patient for the next care provider is something that we can do to build trust for the patient and build some positive on the team and make it more pleasant and more place to work and to provide services.
And that's why I think obtaining feedback is so important. And it doesn't, whether it's a comment card that patients can fill out or an easy way to submit thanks or a compliment on the website, I always suggest to practitioners who are early in their careers, either set up a file on your computer or in your desk, or buy yourself a photo album. And when you get those nice comments from patients and they talk about, what your care meant to them, how improved their lives are afterwards, how wonderful you are, you keep those all together. And then when you're starting to feel a little bit burnt out some years down the road, you can pull them out on those tough days and remind yourself of why what you do is so important. And practices can do that as well. And I think it's an opportunity missed when a practice does collect patient survey data, but then they don't share the comments, or they don't take the opportunity to recognize people who are mentioned in the comments that patients provide in a survey or other vehicle.
That's great. So being able to keep those comments for your internal purposes and to be able to share it when it's appropriate to do so, perhaps in your performance review, and even on those days when you need an extra pick-me-up.
Well said.
Yeah. Okay. So patient satisfaction, what are the key drivers for patients for being satisfied with the services?
Well, we did mention time spent with the person, and most people are probably familiar with the research that has demonstrated, and it's been repeated several times, that patients' perception of the time spent is twice as long if the clinician takes a seat or bends his or her knees to be at an eye-to-eye level at key communication points. And in the most recent research that was published on this type of study, the lead author said, and I'm quoting him verbatim now, there were virtually no negative comments about the clinicians who took a seat. So if you can get that kind of a halo behind your head for something as simple as working your glutes or taking a seat, I think that's worth the moment of thought that takes. There's also some research that has not been published yet, but I think is very interesting. A research team found that there was not a country around the world where people would not view someone standing to greet them as a sign of respect. And are people easier to care for when they feel respected? I think so. And sometimes is it people who don't feel respected in other parts of their life who value it even more when they feel respected in a medical setting? I think so. So time spent, obviously a key driver. Emotional needs met, and that can sometimes be as simple as when you're updating the patient's medical history and finding out, have there been any changes in you're taking your medications as directed, whatever, saying, are there any emotional needs we can talk about today? No, I don't have any emotional needs, but if I see that question on the survey, and it's bound to be there because it is a key driver of patient satisfaction, I can say, no, I didn't have any emotional needs, but they were concerned about whether I did, so I'm going to check yes. Feeling accepted and not judged, and sometimes this is a sense of belonging with the practice, but feeling accepted and not judged is a challenge for some people in healthcare because what are we in? We're in a diagnosis business, and how easy it is to slip from clinical diagnosis to judgment of somebody's, appearance or interpersonal skills or the things that they say, the non-clinical things that they say. So being non-judgmental is another key driver of patient satisfaction. And, of course, above all else, the patient's perception that excellent care is being provided. And that's why evidence-based information on the website, giving patients choices and talking about the probabilities associated with research among 2 or 3 techniques that the clinician wants the patient to consider can be really important.
Okay. So you have given us lots of information, and there is so much more to learn. And you have a program about patient satisfaction that people can sign up to and receive a whole series of information about patient satisfaction, how to implement, and all these wonderful tips and resources. So tell us about your program.
Oh, thank you. Well, it is available at my website, which is susanbaker.com, and it's a free weekly activity that you can do with your team to keep excellent care and service top of mind. I believe that sustainable change is the sum of 2 things. It's passion and repetition. It's the passion of leaders to care about it and make it a top agenda item at every team meeting, and then it's repetition. It's caring enough to repeat it over and over and over again. I sometimes tell a story, which I won't go into because we don't have enough time today, but my first boss was a man by the name of Mr. Zagrodny, and Mr. Zagrodny would end every single meeting, whether he was meeting with you alone or he was meeting with our entire department, he would say, "Ladies and gentlemen, you're never sorry you were kind." Or if he was meeting with me, he would say, "Miss Keane, you're never sorry you were kind." And to this day, he's deceased now, but to this day, when I run into someone who also worked in that same department, we'll always just look at each other, smile, and say, "You're never sorry you were kind." He didn't need to say it after a point in time, but we just, whenever he came to our mind, we would know that that's what was his top priority, and so it had better be ours. So the purpose of the course is just to keep patient satisfaction as in a very time-efficient way as an ongoing priority for the practice.
And that's a wonderful motivation driver for wanting to implement a patient satisfaction program. The activities and the emails that you send out as part of the program, I subscribed to the course last month.
Thank you.
And it's wonderful. It's very straightforward. It's not a lot of jargon. It's easy to implement. And you provided all sorts of activities and train-the-trainer types of resources so that somebody who is themselves new to a patient satisfaction program could still be the person that is receiving the resources and disseminating it and making sure that the patient satisfaction program actually gets implemented in their practice.
Thank you. I appreciate that feedback.
It is a wonderful program, and I absolutely strongly encourage everybody to sign up for it. So having a program and having the resources at your fingertips is one part, and being able to sustain that patient satisfaction program within your practice is another step. Any tips that you want to offer us about that?
Well, I think there are two things that I would say. One is to focus on observable behaviors that apply to everyone. And typically, when companies look to rebrand themselves, they'll usually start with telephone skills and the way the telephone is answered, which you might think, wow, seriously, is that so important? But if you've ever worked in an organization where one person answers the phone in a very sing-songy voice, "Good morning, this is Susie Sunshine at Halifax Pediatrics. I'm here to serve you. How may I help you, please? It would be my pleasure." At the very next desk, the person picks up the phone and says, "Baker, what?" You know what that inconsistency costs you. So having observable behaviors, people either use the phone, answer the phone using an open script, or they don't. They make an effort to stand to greet people or take a seat to be eye-to-eye contact, or they don't. They immediately acknowledge the person, or they don't. So observable behaviors make it easier to coach when people need some shoring up, some remedial help, because then it's observation, it's not judgment. And the second piece is understanding that I believe the key driver of patient loyalty is that people value experiences in which their unique preferences are identified and respected. So a very simple tool could be a card that just asks patients to fill out while they're waiting. I've been a patient before, and something that impressed me. This time I'm concerned about, and I'd also like you to know. And a lovely story that I saw recently from the University of North Carolina Hospital, they implemented something similar on their whiteboards in patient rooms. They just asked patients something else you'd like us to know, non-clinical. And one patient wrote that he sang in his church's gospel choir. Well, a surgeon made note of that when he was visiting the patient, and when the patient was scheduled for a biopsy, and he was going to be awake during it, the physician had his iPad there, and he had set it so that it would play gospel music. And for the patient, this was everything in terms of feeling cared for. And so finding out what those preferences are and either respecting them, that's great, or at least managing them. If it's something that your practice absolutely doesn't do, you have an opportunity then to explain why you don't do that, but what you do offer or what an alternative might be.
That's an excellent opportunity. And you've been very generous, and you've offered us the first impressions checklist from your program as an example about the types of things that your program offers, and some great questions that we can take away today and do that self-assessment. So we can use the first impressions checklist, as you suggested at the top of the interview, with our team about how we think we're doing as a team in our practice before we share it more broadly to patients or to anybody else. So we've got an example about your program on the first impressions checklist. The Learning Resources Guide that we have here on our website gives the links to the program, to how to sign up, how to contact you for more information, and to be able to follow you. You've given us some great tips about implementing a patient satisfaction, why it's so important, and some really easy things that everybody's doing about making sure that patients have access to trusting us, confirmation that we're good about what we do and that we care about our patients. Is there anything else that you'd like to share with us today, Susan?
Well, if someone is looking for a formal written patient satisfaction plan, I do have a 4-week patient satisfaction plan on my LinkedIn profile, and I'd be honored to link with anybody who wants to invite me to do that. But if you just go to my profile on LinkedIn, you'll see actions that you can do as a team, some action assignments, and some gracious communications for week 1, week 2, week 3, week 4. And I think that if you did those things with your team, you would be off to a great start.
That's incredibly generous, and thank you very much for that. You've got a great wealth of information, and you're so inspiring. So,
oh my gosh! Thank you for saying that. I'll tell my dad. He's still wondering why I don't have a real job.
Well, we'd love to have you come up to Canada and present and do some speaking opportunities. I know that's one of the things that you do in your consulting and your speaking business. And I'm hoping that we have someone who will take you up on that opportunity and be able to invite you for their next association conference. What other types of events?
Well, it would be my pleasure, but the thanks go to you, Jean. You conduct a fabulous interview, and this has just been so much fun.
Well, thank you. We need to wrap up today. It's been so much information, and I'm so excited about it. So we've talked about a lot of valuable things. Would you like to summarize that for us, Susan?
Sure. Well, we did talk about the importance of making team members aware of what those survey questions are, and then sharing that feedback, especially the positive comments, thinking about what patients want, that they care about the time spent, whether their emotional needs are met, feeling accepted, and a sense of belonging. And we talked about those 3 questions to find out what's impressed the patient before. I've been a patient before, and something that impressed me this time I'm concerned about, and I'd also like you to know. We mentioned the importance of observable behaviors, because then it's observation, not judgment, when someone needs a little bit of remedial help. And tying this all up, answers the questions, those all-important questions for patients. Can I trust you? Are you good at what you do? And will you care about me? And I think we also mentioned the after-visit summary as a way for patients to take the value of the visit home with them.
We did all of that, and all of those things we can then repurpose and use as far as our practice management administration about recruiting, training, hiring, and doing performance evaluations for our staff to be able to grow our staff and to be able to make the practice better so that we can provide better patient satisfaction.
For sure.
Excellent. Okay, it has been a wonderful opportunity to speak with you today, Susan. To our audience, let's stay connected. We are here just about every Thursday with the live interviews. The interviews are available on a replay for a limited time. You can join us as a member of Information Managers and have access to all of these great interviews at a time that best fits your schedule. I'd love to connect with you on LinkedIn. Send us an invitation. You can also request to join our private members group in LinkedIn for Practice Management Nuggets. All of the resources that we've talked about today are on our Learning Resources Guide, and I encourage you to download the resources offered by Susan today and follow up on her excellent and most generous offers about her programs, both by email and on the LinkedIn program. I'm on Twitter at InfomanLTD, and now we're on Facebook. Be tickled pink if you'd like us. My email is jean@informationmanagers. And each month, I host a practice management Q&A where you can ask the questions, and our members contribute to the discussion and the sharing. Susan, thank you so much for joining us for Practice Management Nuggets. It has been great to have you. You are an inspiration, and I look forward to talking with you again.
Thank you so much, Jean. I've enjoyed every minute.
This is Jean Eaton, your Practice Management Mentor, asking you to stay tuned. I look forward to seeing you again at one of our upcoming events.